Welcome back. This is Fantastic Pains and How We Hide Them. I'm not Chris.
And I'm not Karina.
But we're here together.
As usual.
For more fun times.
And shenanigans.
If this is your very first time joining us, welcome to the show.
Hi.
This is our sibling duo podcast / YouTube channel about...
All those things.
Yes. About life with chronic and invisible illnesses, including those that are mental and emotional.
Because I'm mental and she's emotional.
Always. Yeah. Where can they find us?
Oh, God. You can find us all over. We're prolific. We're on every podcast platform except for Apple. And
Never.
Just most. You can find us. It's not hard.
Yeah. Just Google Fantastic Pains.
Yeah.
It's right there.
We're on IMDb if you want to get some...
Stop reminding me of that. It's weird. I don't like it.
Get some production credits going for my classes. Hey. We're also on YouTube if you want to watch us. And you can join us and join the Discord family.
Yes.
Where we get ideas for our episodes.
Yes. Today's idea was brought to us by one of our longtime subscribers and elder zebra, Ruth.
Yes. Thanks, Ruth.
Who has this magical ability to synthesize what's happening in our world and put it into an episode. And there we go. It's right there. It's wonderful.
Yeah.
So thank you. We appreciate it. We'd like to also say hi to somebody else, right?
Oh, yeah. Hi, Eddie. You better be watching this because you told me that you were going to watch this.
He even wrote it on his hand.
See?
Hi, Eddie.
This is Hi, Eddie.
Yes. What are we talking about today?
The cycle. The cycle of change and in relation to illness and how it can progress or change in ways that you don't see coming and then how to handle it.
Yes. So it's more of the cycle of learning how to establish new norms.
Yeah.
And to live with those new normals.
And keep your head on your shoulders at the same time.
Right, exactly. And allow yourself some space to grieve the loss. Because that comes a lot when you are chronically ill.
Yep.
Especially if you have multiple disabilities. Or disabilities that change often. So, before we can do that, it is time for the weekly recap.
Check in.
Pow. Do you want to go first?
I have to go first because
so.
our topic is your week again. Chris will get an episode soon. It's like the writers are
it's
just
my
heavily...
turn right now.
It's the numbers, right? So
they have to make up for you having sepsis last year.
It's stupid. The writers don't get what's going on, right? They think that because she's a girl and she's a minority, that people will watch just for that. But really, it's starting to get on everyone's nerves.
They're just cramming it down y'all's throat.
Yeah, it's disgusting.
They're like, God, she's brown. We get it.
Anyway, my week was pretty good. I have to say that.
You have to disclaimer that, though.
Right.
What does pretty good mean?
I wasn't hospitalized.
Yes. So let's back it up.
I feel it's really unfair because why can't my week be good if it sucked all week?
And but now it's all better?
Right. Like
what? Your week was not tragic. That's what it is.
Yes.
Your week didn't end in or begin with major disaster.
That's a trauma thing. That has to be a trauma thing.
It really is because that's why we adapt to everything.
Yeah.
Because we're like, oh, that's fine. Oh, this is also fine.
Exactly.
Oh, that's fine too. And everyone's like, why are you not fixing this? And you're like, because it's fine.
It's fine.
I don't mind.
Right.
It's the trauma thing.
Totally.
I'm going to go back and look and see if we had any messages this week.
No, we didn't. No, I did. I had a dire. I had 2-3 days that were really bad.
Yes. So on the 10th, you were rough but moving.
Yeah. I was like, I got to keep moving today because I don't want to stiffen.
On the 8th, you were just death. And you were begging for the end.
Yeah. That was Monday?
What was the 8th? I don't know days.
I think it was Monday.
Yeah, the 8th was Monday.
Yeah. So my knees have been really bad lately.
Yes.
To the point where I can't get up or down. Like when you guys got here and I got out of bed, I collapsed just putting weight on them.
That's not good.
Like this one just completely gave out.
Just goes out from under you.
Yeah.
Does it do that nasty tendon snapping?
Yeah.
Oh.
So, and they hurt all the time. I've been icing them and I never ice things. But I've been icing them at night. Elevation. Yeah. I've been keeping anti-inflammatories in my system.
Good.
To keep it from being
You've
angrier.
Got, the extra strength Tylenol.
Yeah. But nothing is making it better. Like I even wore the brace. It's just something's damaged.
Yeah.
And I need to go have it looked at.
Yeah, you need images.
But I'm going to go in and there will be nothing wrong with me and I'm going to be upset about it.
Yeah. That is the way it goes.
Yeah.
Because I don't know, for those of you who don't know about Ehlers-Danlos syndrome, it's this fun thing where your body just is like, I hate this one body part, and it'll do that for a long time. And then the second you're like, let's go get it looked at because I'm tired of it. It's been about 6 weeks now. And then you go and it's gone. Or like the week leading up to the doctor's appointment, it has disappeared entirely. And then something else is crying.
I have to say, because I was listening to that and I was applying like the cynical lens to it. I could see how like medical professionals and how normal people could interpret that as observation bias kind of a thing. Like, it's convenient that it stopped being there when you went to see the doctor. Right. Like, it's not convenient, you assholes.
No, it's not. Well,
really inconvenient.
Let's contextualize this real quick. If in fact we were like jumping to go see the doctor for no reason, we would not have let it go on for 6 weeks prior to seeing a doctor. We let it go on that long to make sure it's actually a thing.
Yes. Yeah. That's where I'm at. Like, it's been getting worse, but it could just clear up any day.
It's been like 3 weeks though.
I know. We're getting onto a month.
Yeah. So I'm like, do it early. See if you can get in.
I'm sure I could get in.
Yeah. Get the images done at least. Because even if it's not images.
Yeah.
Or if it's not like appearing in the images, they might have some suggestions or ideas or something.
Yeah. I'll do that. I'll message my pain management.
Cool.
Because she'll just send me the referral.
Yeah.
Like she did with the
She's
ablations.
wonderful. She's been really good.
She is. I want you to come next time I have an appointment just to meet her.
Well, in the summer I can do that too.
Exactly.
Yes. That would be good.
Anyways.
So bad knees.
And my hip. But I think the hip is from the knee and not the other way around.
Not the other way around?
Mm-mm. Because I'll have days where the hip is perfectly fine and not in pain. But the knee is. And then when I try and adjust the knee.
Oh, yeah. We talked about that.
Yeah.
Because it's that like. There's so much more to dislocations and subluxations than just like it popped out.
Right.
There is like a whole rotational, like the laxity in our body is not just like, oh, it stretches this way one way.
Right.
It is like we can turn all the way around one way or all the way around the other way. And those rotations, it's like the opposite of picking a lock.
Yeah.
Kind of, right? Like one thing will go out and it'll throw the other thing out and it'll throw the next thing out. Like shoulder goes out, you feel it in your thumb or your wrist or somewhere down here because everything else is impacted.
Yeah, and the other thing is it's not going down to my feet either.
Yeah.
And I would usually when it's hip, it goes down. Like that nerve follows.
It's the nerve. Mm-hmm.
So that's why I'm pretty confident. At least this one I think is the knee. This side could be the hip, just being the hip because hips.
Could also be compensation.
Yeah, because I've been putting more weight on this side than that side lately. Yeah.
Right.
But I've been fighting that, and that wasn't fun.
No. Not a good time.
Well, and I'm reducing like my dosage too at the same time. Mm-hmm. Like we're going down so that I can get down to the 5 or the 7.5s.
7.5s, yeah.
And we've made progress, but it's like I hate that I have to do it while my knee decided to crap out on me.
That bothers me a lot because it's like you'll make a plan and then extenuating circumstances happen. Yeah. But then in our head, we can't excuse it based on those circumstances. So we're like, oh, it's an excuse.
You know,
it's really not an excuse.
What's really sweet, though, is that when I saw my pain management last time, she asked if it was doing okay or if we needed to go back to the 4.
Okay. Like, so she's not like dead set.
No. She's like, that's totally been my goal.
Good. Okay.
I came to the table with that because I want winter to not suck.
Yes.
And I don't want to. I just don't feel comfortable going over.
Up. Yeah.
Like that's where my max is, and I don't want more than that. So
right. At least as far as like dosage.
Exactly.
Right.
So like, she asked, and I was like, yeah, no, it was manageable, and we're coming into summer, so it shouldn't be as bad. But
yeah,
we'll see.
Spring has.
She also had a student.
Oh, cool.
And they were like, so she has a student with her today.
Oh, they were all apologetic. Okay? And you're like, no, it's fine.
I was like, yeah, absolutely. So she did the the onboarding or whatever.
It's my face, dude.
Ugh. Jinx.
Sorry.
She did the I guess the, what's it called?
The intake?
Basically, yeah.
Yeah.
She sat down and was like, what are you here for? What's up? What's this like?
What the nurses do. Okay.
Mm-hmm. And then Natalie came in after the fact. It was very, very sweet though. They were very nice. Even the student, like for the student, I was impressed that they weren't more kind of awkward, I guess.
Yeah.
You know what I mean?
Well, when you are in such a place, like it sounds like there is just a very clear sense of non-intimidation, right? Like they're not stuck up and snooty and stuck in their way.
No.
So I mean, it makes sense to not feel so awkward in that situation,
right.
Because if they're as good with students as they are with their patients, that's a really great environment to learn in, and a really safe one to learn in.
Yeah. No, I love when students are like around, like student doctors. Even when I had my dog attack.
Oh yeah.
I can tell this story real quick. It's quickie.
No, go for it.
So we were visiting family, and Sophie wasn't even a year old yet.
Yeah,
she was walking, but she was barely walking. And they had this dog that was more of a pack animal than a domestic
like
dog.
11 dogs on that property at any given time.
There were, yeah. It used to be that way. Now there's just the one little dog.
Oh, okay.
It's very cute. But the dog reacted bad to Rin because she was tiny, and she turned her corner, and I think she was near his food or something.
Oh. And
he was very territorial. So I was sitting on this counter looking at the dog, just talking to people, and the hairs on the back of his neck stood up, and he growled and walked towards her slowly. And I was like, no.
Like stalking her.
Yeah.
Ooh.
So I grabbed it by the neck, and it turned around, and it just wailed on me. And I let it.
Wow.
You know,
well, because you're like, better me, like, the redirect than letting him do what he was going to do.
So he got me all over my arms. He gave me this divot that's moved from here to here.
Oh, wow.
And it was ugly. Yeah. There was blood everywhere.
Oh, I bet. And then you punched it.
Well, well, I was like, we need to put him outside. And they were like, we can't because the other dogs are outside. We'd have to swap them. And I was like,
because he being near
he just went after Rin.
Yeah.
He can't be in here.
Right.
And they didn't listen. So I went outside and I had all the adrenaline in the world, and I was bleeding, and I was like, that's stupid. And I punched the wall, and I shattered. I got the boxer break.
Broke his hand.
Yeah, I did. And then I drove home 19 hours, and then dropped off Jen's mom. And then they said, oh, you should probably go to the hospital because it's not looking good. I'm like, yeah, no, it hurts really bad.
Yeah. Well, and it's a dog bite.
Yeah. So this is where it comes together. When I was at the hospital, they had these students. It was their first day out on the floor in the ER.
Yeah.
They hadn't done anything yet. They were like new. There were 3 of them, and they were told to clean out my wound. And they had that like spray syringe thing with like a little guard.
To flush it and debris it. Yeah.
And they were doing it all like, debris. They were doing it like really softly.
And you're like, no, bro.
I was like, guys, it's not like, oh, are you okay? I was like, guys, I'm fine. Can we just maybe? Yeah. So then like the like head nurse on the floor walks up. She goes, you got to do it like this. And like drained everything. So they all take turns doing that. And it was just cute. It was funny.
They're funny. Oh my God. Because they haven't learned that like, and it's such a delicate balance, and it's why people become so jaded over time, is because medicine doesn't always feel good.
No, it doesn't.
But it still has to be done in order to prevent more harm. Right. And so the compassion lies in doing what needs to be done, not in preventing pain.
Yeah.
Which is hard.
Right.
For a lot of normal people who, not normal, you know what I mean?
Well, and I made it easy on them. I didn't react at all.
Yeah.
Like, I was just like chilling. I was like, go for it.
Made it really hard on them.
I thought I was going to go, but
they would have cried.
Yeah, no. They thanked me a bunch as I went out to go get my x-rays.
Cute.
But it was just funny. But yeah, it's been a week. been watching stuff with Rory a lot, which has been fun.
Good.
Like, because Rain and I had like movies that we watched together.
Yeah.
And Rory kind of gets left out of that because she wants her time.
Yes.
Like her space from
Oh,
him.
yeah. And like she'll claim her like one-on-one time.
So I've been making time for Rory,
Uh-huh.
which has been really good. Like he's been, the way he's reacted to it, like he's calming down and he's like,
because he adores
less.
her. He would never like claim his
No,
own time
God,
without
no.
her ever.
No.
Like that's not something he would advocate for.
No.
Because he puts her first in so many ways. It's the sweetest dang thing.
It is. And then gets offended when she's mean to him, and he takes it different. And then she's like, "Why are you defending him and not me?" It's like, because he doesn't mean it the same way.
Right.
He's hurt emotionally and he's lashing out, and you don't believe him when he says those mean things, and he kind of believes that you do. So yeah. But we've been watching Fallout.
Nice.
Which isn't a kid-friendly show.
What is it on?
Amazon.
Amazon. Okay.
It's actually really good.
They have a bunch of good stuff coming out. Yeah. They picked up their game. Dang.
Mm-hmm. But we watched it, and then he got the game because it was on sale. So Jen bought him Fallout 3 Game of the Year, like all of the expansions.
Fun.
And he's just been having a blast.
I bet.
And the Pokemon thing's been really nice too. Like since everyone's into it, even Rin like is playing it now. So everyone in the house has their own deck, and like I made them.
You have like family fun things that everybody can do.
Yeah.
I love that.
It's been nice. So that was my week. It was family and pain.
My shoulder's out. Feel this. Feel how out this motherfucker is.
Whoa, bro.
So super tight.
Look at that right there.
Yeah. Husband, I need you. Please hold.
I'm not cutting this. Do it in front of the camera.
Do it in front of the camera.
If you can.
Let's see if we can. I don't know if I can see.
If you stand right here.
If I stand, they'll be
Yeah,
able to see.
your arm will definitely be in the shot.
Okay. Let's see. Ready? 1, 2, 3. Mini one.
I think you got caught by the mic though.
Oh really?
Yeah.
1, 2, 3. Right here. Too tight, maybe? Oh, wait. Okay, no, I think we'll leave it. Thank you. We got something. I'll take something.
That moment you know someone
some of
knows
the
what
pressure.
they're doing because they do this.
Oh, yeah. I love that when you, like...
Yeah.
Any practitioner
You're turning off your eyes to go and visualize what you're touching so you could see it with your hands.
Anybody who can, like, see with their hands is just,
Yeah.
They're like, oh, you're going to give me the help I need.
That's what we do. And Randy did
Love
it.
it.
I was like, yeah, he knows what he's doing.
Yeah.
He's got this.
And my massage therapist does it. And the new PT does it.
Nice.
Which is great.
Okay. So, no, I mean, that was my week pretty much.
Okay.
I want to talk about the live real quick.
Oh, yeah.
They were
The
very
live
good
was
this
so
week.
good. It was a lot of fun.
Mm-hmm.
We had a really good time.
Yeti was there.
Uh-huh.
We had Rajika. No Creek.
Yep. We had Ruth.
Sad Creek. Why do you hate us?
I know. No.
Kidding. I know
I'm
you.
like,
I know you
stop
don't.
that.
We know.
No, we had a wonderful time with everybody, and we are hoping Doggo is doing well.
Yes.
We miss you, but don't feel pressured. We're here when you're coming
we're
back.
Expressing
it's all good. Yes.
that you are missed, but not in a like mad
Come back
way.
No, that we love and care about you, and we notice when you're not around.
Yes.
Yeah.
Okay.
All right.
Your turn.
So diving into my week, was therapy Monday? No,
Wednesday. Right? Because you did.
No,
Oh,
it
therapy's
was
Tuesday.
Wednesday. Yeah.
Yeah, because
So Monday was Monday. I don't remember if anything crazy happened on Monday. I don't think. Let's go back because it was the 8th, 7th.
Mm-hmm.
So on the 7th. Oh, that's right. I had a crazy MCAS attack. That was horrible. I took a surprise nap.
Yeah.
I don't know what happened on Sunday. That was weird. So I had a surprise nap followed by a crazy MCAS attack. Where I had my eyelids swell up again.
Yeah.
Which was weird because this week, 2 of our kids came in like that with just swollen eyelid, and I was like, "What in the world? What is that? Is it something? I don't know."
Yeah.
And fatigue was pretty icky. And then I had therapy on Tuesday.
Which is really
and
good.
That was actually really productive and really good. I was so close to making it home to get there to like do my thing, but I had to pull over and park and do it in the car because she won't talk to me if I'm driving. So I'm like, I'm literally a block away from my house, but I stopped and parked and we did our meeting. And it was a lot of me like telling them that I was not happy with the way things were going and the way things had gone. Because I don't know if we had it. I don't know if I talked about it last week, but the shattering of trust.
Yeah,
we talked about that.
Yeah. See last week for everything.
Yeah.
And she was able to express all of that, which is really impressive, honestly, that you were able to get to all that.
Right. Well, I got it all out and was just like, listen, what I need from everybody. 'Cause she was like, well, what are they not doing that you need? And I was like, I need them to say that there are options or they can't help me.
Right.
Because it was one of those, like, either, like, stop stringing me along. Because that is driving me crazy. Because they went on this, like, information gathering hunt, and it was rubbing me the wrong way.
Yeah, well, the way they approach it,
Especially because last week started with the nurse being like...
Yeah.
really kind of icky and underhanded and microaggressive, and it didn't feel good. And so I was able to separate, like, this is how I feel, and this is probably the truth.
Yeah.
Because you can hold both things. It's frustrating to be able to hold both things because you can't invest in your, like, this is my headcanon, and it must be the truth. You're like, this is what I feel, and this is probably the truth.
Yeah, you're allowed to have feelings and express your feelings. Yeah. And you're just pointing out that you don't believe them necessarily.
Right.
You know that it could be just how you're interpreting.
Yes. And that was the thing, was to be able to tell her that, like, the way they were gathering information seemed so accusatory.
Yeah.
And lacked compassion at all. And, like, there's just no drive for anybody to do. It's a lot of that, like, they're doing stuff behind the scenes that I can't see.
Right.
But they're not communicating that.
Real.
And they're just leaving me in the dark. And so talking about that was just like, that helped a lot.
Yep.
And she asked me if I felt like I could advocate in that space. And I was like, no, I really don't.
No.
Because talking to them and having them talk to each other over me, it just feels like I'm sitting with mommy and daddy and I'm getting in trouble.
Right.
And then I go into trauma response mode.
Mm-hmm. You shut down.
Yeah. Or I like fawn. Yeah.
Yeah, no, you know what I mean though. Like,
exactly.
You're not engaged in the.
Yeah, I can't defend. It feels like I have to defend myself. It feels like I'm in court, right? And so she was like, "Okay, do you want me to advocate for you?" And I was like, "Yes, that would be really helpful, actually, because I don't feel like I can. No. We don't have the rapport. We don't see each other often enough. She has things in her head that are not true. That she comes to the table thinking,
literally, she does not remember you.
No.
She was mixing you up with other people and treating you for things you...
Yeah. Oh, and then that came up the next day when I had my appointment.
Yeah.
So I don't remember, I think... and then she was back on the, like, are you safe? And I'm like, yes, I'm safe. It's just...
Yes, Mom, I'm not going to hurt myself.
Fine. Like, I've been hurt by unaliving or self-unaliving, and I would never, ever do that to anybody in my life. Like, that's not... It's just one of those, like, I've been dropped off here and I gotta wait until Mom's done at the supermarket before I can go home, but I'm bored and I'm like,
no, it's
noisy here and I don't really like it and I'm uncomfortable and want to get out of these clothes. I want to take my bra off, my, like, soul bra. Can I take my soul bra off? And so she was back on the, like, you need to go see the psychiatrist.
Sorry.
I'm like, I will do that later.
Sorry. I got stuck on a thought. Because you said soul bra, but bra are just boob pants.
Yes.
So is it soul boob pants? What is it?
It's my soul boob pants. Okay. My soul shoes. I'm going to take my soul shoes off. That might make more sense.
Yep.
Ugh, it hurts me watching you do it. It's ugh. And you're not expressive when it comes to being in pain. So, like... You being expressive says that hurts a lot.
Yeah.
Ugh. Oh, the other part of it. Yeah. The other part of it was like, I don't feel like I'm given credit.
Oh, God.
For
No, you weren't.
all of the work that I do and have done and continue to do. And the fact that I'm not a pain in the butt.
No, it's like a double-edged sword.
Mm-hmm.
You were not getting the credit. It wasn't just a feeling, because they literally thought you were a different person.
Right. Yeah.
And that you were doing things that are inappropriate.
Exactly.
But they'd also not remember you because you're not a problem patient.
Right.
They think they remember you enough.
I'm invisible, but I'm also like written over.
Right.
Which is weird.
Not how you want your relationship with your team to be.
No, not at all.
Yeah.
And so that appointment went well, and I like screamed it out and cried it out and raged it out, and
good.
We were okay. And then she said, because she was able to give me context was the big thing.
Yes.
Because like after I had gotten it all out, she was like, do you want me to add some context? And
yes.
I was like, yes, please. Like, I'm not just sitting in my feelings.
That's kind of what you've been looking
defending
for.
my feelings.
Right.
I need the context. And she's like, we are meeting about you, and we are thinking about you, and we are trying to do things for you. We met about you last Thursday.
But nobody's telling you these things.
Exactly. And so she was like, what, you are correct when you thought that maybe she could be information gathering, but she was just being insensitive. And she's like, I can't speak to the way she emails, which is polite and professional for, no, she emails like crap.
Yeah.
Sorry, it's hurting your feelings. I can't fix it. It's bad. Because it is. It's bad.
Blah,
it's
blah,
all
your
just,
feelings.
Blah, blah, my fault.
Yeah.
That's what it is. And so she was like, we are talking about it. The information gathering was to see if there was just a simple solution or a simple fix that we could put into place and hopefully give you some relief or some
nobody
help.
said that, man.
Yeah, it was like
all of that
IT.
could have been avoided if they just included you in.
Yeah.
Like I feel like if they're having conversations about you behind the scenes, that you should be CC'd in them at least.
Exactly.
Like that way you can know that they're doing stuff.
Right. Or have it put in like in my chart or something.
Yeah.
So she was able to give me some context there that made it feel a little bit less icky.
Yeah.
Wow. And then she was like, I'm going to reach out to your doctor and see if we can talk today before you see her tomorrow. And she was able to do that. And then the next day, meeting with my doctor was like a whole different experience.
Yeah.
Like a whole 180 from the experiences that I've had in the past with them. And it was just the one doctor. Mm-hmm. So she wasn't talking over me. It wasn't double speak. And
exactly.
Cutting everybody off, and mommy and daddy are mad and they're yelling at me. And so she, I don't even know. Like we went through the chart from the neurologist who told me that he didn't want to be my doctor and was like, you're going to be a professional patient if you keep pursuing answers.
Yep.
And she was like, well, his notes released and I'm looking through them and it says here that he thinks that it might be small fiber neuropathy.
Which is
I was like,
news to everybody.
And nobody told me? Like, he had a theory and he didn't tell really?
No.
Really?
He really didn't want you to be a part of your team.
Oh my God.
That's can you imagine? You're like, there's this person who needs help, and then they come in and they're like, I have this thing, I think it's this, and they're like, oh, I don't want to take care of that. Mm-hmm. And then like you leave and he turns to the nurse, that's probably not even transdermal neuralgia. Exactly. And then like what you could have just said.
Yeah. What right? Jerk. Like put me on to something, because before all these appointments, it was literally like, too bad, so sad, you're screwed, bye, figure it out. I don't know. And so she's sending it back to him to be like, hey, do we need to do a biopsy to find out for sure if it's small fiber neuropathy? Yeah. Which makes perfect freaking sense, considering that I already have small fiber neuropathy in my hands and my feet.
Yeah, we both do.
And I learned that it can affect like through the face and the trunk. And that might be the source of the abdominal wall pain. Yeah. And the spasming that I have that is just horrible.
Well, it fits everything too. It fits seasonally.
Right.
It fits temperature-wise and pressure, and like body pressure changes. That it makes so much more sense.
It makes sense. And it's not...
And there's things that you can do too. Like getting one of the what's it called?
Neurostimulator,
Yeah,
was one
neurostimulator,
option that they mentioned.
And since they know what if it is that,
Yeah.
they'll know how to better treat it, because you won't be
Right.
on the
carbamazepine.
Yeah.
That would be nice to get off of that one, because I don't like that one.
I think that one's just really only for your face, right? Like,
well, it was for the retrocollis.
Yeah.
Yeah.
I like how I just have to.
You're like, it's the one that makes you go, ugh. Yes, that one.
Makes you look like a Pez.
Yes. And stresses
This
out.
giant tablet comes out, and you're like,
just,
you want this?
It's a baby.
It's a baby.
It's a baby.
It's a baby.
Sorry, I hate everything that I just said. Oof. But yeah, like, it's a totally different experience because she came to the table like a human person, but she still got it wrong. She was like talking about my like Percocet use.
Yeah.
And she was like, well, but I feel like we've had a pretty steady trend of like going up on that. And I was like, no.
Excuse me?
No. We went up one time, and that's because we upped the dose. And actually, I've gone down on the dose again. So, no. And she looks at the chart and she goes, oh, yeah, no, that's not you. Never mind. I was just like, this is the problem.
That is, yeah.
This is literally the whole of the problem.
Dude, it's upsetting, and
oh my God. That they're just...
there's no connect. Maybe there's not, now that you've made noise.
That's my hope.
That they'll remember you.
Otherwise, we're going to have to do this every time, and I'm going to have my therapist be the liaison.
Oh, yeah.
Essentially.
From now on, just schedule with her before every one. Good to go.
Well, and my doctor, she must have really heard her, because she even said, she was like, well, talking to your therapist, going through all of this stuff, like, the work that you've done it's really a lot. You've done a lot of work, and a lot of good work, according to your therapist.
Yeah.
And I was like, yes. Thank you. Finally.
Literally what we were talking about last week.
Yeah.
Like, that you do these things. You've
Right.
been doing them.
Yeah.
And you haven't been a problem patient in any way.
Right. And I don't fight them on things.
No.
Like, I want it to be a conversation.
Yeah.
Yeah. But, well, and then the conversation turned back to where we were kind of last year.
Oh,
where we're going to try the low-dose naltrexone.
Yeah.
In the summer with ketamine infusions.
I'm so curious. And
I'm very curious.
Scared.
It'll be very interesting.
So
I might
scared.
just have you go with me.
I wouldn't mind. They're like hours long, but if you
Yeah.
want, if they'll let someone be like in there reading a book or something,
Oh, maybe.
just to have like a comforting
Yeah.
person around,
Right.
I would do it.
'Cause, yeah, I'm curious. I don't know. There's a major wait list, so it probably won't even be until
Like way
May,
late
June.
in the year.
Yeah. So we'll see how that goes.
We'll see.
But my whole thing with that was like, you guys are asking
Options.
Yeah. Well, and you guys are asking me to let go of a lifeboat that I know, or like my little ring that works, that I know works,
Yeah.
and is there for me to bail out of the pain if I need to, for something that I don't know if it'll work.
Right.
And I don't know if I can go back if it doesn't work.
Exactly.
And she was like, the amount of like medication you're taking is not a lot. The problem is that you are still really impacted, and we just want to try something else to see if we can get your baseline up.
Yeah.
Right.
She literally said you could go back.
Yes. And that was the reassurance that I needed.
Yeah.
Was like, if this is a massive failure, can I go back to what was working?
It's also really nice because it makes that door openable.
Mhm.
You know, because before if you were, that would be like a scary subject to bring up.
Right.
Like, hey, can I go back to the illicit
Mhm.
thing that you might think that I'm abusing?
Yeah.
Because you have that in
Right.
your head for some reason.
Right.
No, she's like, no, yeah, we can go back. So
Yeah.
now when
Yeah.
you
So
have
now I can leave that door cracked.
Yeah.
So that it's still there. Because that's the thing is like, it really is that like life vest for
Yeah.
me. It's the only thing in the crazy that I know is there.
Yeah.
And I even explained to her, I was like, just having it helps me to not use it.
Yes.
Because I know it's there.
Right.
And
you
if it
have
gets
the
bad,
emergency.
I can use it.
Yeah.
And so that helps me to just push through when I can.
Exactly.
Um,
You get it. She
yeah.
gets it.
right.
I get
So it was actually a really good appointment. And I don't know. We'll see what happens.
Yeah.
So it's looking like face biopsy getting scheduled for the summer.
it. Yeah.
And then we'll
Information
swap
gathering.
over mid-May and see what's up.
try that out, and if it doesn't work, you can go back. No biggie.
Exactly.
No harm, no foul.
Yeah. So hopefully all goes well.
Yeah.
But it's really just one of those things, like last week and then this week, this is the life that we lead, right? Like this is how it works.
Yeah.
And while we talked about it last week, that same frustration has been building over more than a year.
Yeah.
With them, and how frustrating it is to communicate with them
Yep.
and have them not be communicative with me. But it really is that it's a good example of the cycles that we go through with the diagnosis of something or the non-diagnosis of something, and seeking a diagnosis for something, and being in limbo versus being in motion.
Right.
Because that's really the thing, is like before, when it was that trigeminal neuralgia and all the doors were closed to me, I was just screaming into the void.
Right.
And that is so frustrating and anxiety causing. And
oh God.
Upsetting, and I wanted to self-isolate, and
it's like being led down a hallway to a dead end.
Yeah.
And then they turn the lights off.
Right.
And they leave.
Like, okay, bye.
And you're like standing there waiting for them. But really what they're doing in the background is they're getting all the shit ready for you. They're just not telling you about it.
Right. But now I'm sitting in the hallway in the dark and I don't like it.
Right. Like, can I not?
Right. Well, and now with this new possibility, even though it's not like a full diagnosis, it is a possibility. And it comes with more options.
Yeah.
And it comes with treatments, and it comes with like things that we do know and things that we can do.
Yeah.
And just that opening of a new door is so anxiety relieving.
Oh, yeah.
And just, it makes it easier to wait. It makes it easier to bear it out. Because even at the end of the appointment, my doctor was like, I don't feel like we've helped you any. And I was like, no, but we have a plan.
Yeah.
And that helps.
Yeah.
That helps.
A lot.
I can tough it out until the plan is in action.
Seriously.
Yeah.
Yeah.
Because it's different from just like tough it out indefinitely. Okay, bye. And you're like, I can't do this.
Yeah.
I cannot. But I can wait until May and June.
Yeah.
That is okay.
You could wait longer too, honestly.
Right.
Now that there's an actionable plan.
It's like surgery.
Right. It's like
where your shoulders hurt. Yeah.
Like, yeah, I got this now.
Yes.
Because I know something is being done and can be done. So
like there's something on the horizon, and I'm actively walking toward it.
I had a question.
Yeah.
Do you think that because we'd been talking the week before about it and we did the episode about it, that you were more ready to talk to Jackie?
Yes.
Okay.
Because it's that like pre-chewed thing, right?
Yeah, yeah.
Where I don't know. I feel like emotions are digested in chunks.
Yeah.
And then sorry, my brain went like a cow. Redigest the same thing.
Different analogy.
Sorry. Ooh. I don't know where to go. Help me. New analogy.
Skill building.
Okay. Yeah, practice.
Yeah.
Good. God.
It's like anything. You have to understand it. Like that's why I'm glad we did the whole episode last week about it.
Well, and that was so nice, and I really appreciate you doing that, because I felt better afterwards. And
good.
It's different to be able to sit and like really get it all out.
Right. Because we got to fully explore it.
Yeah. And like the implications and what it means and what it doesn't. And yeah, it just helps to be able to mull it over and then be able to kind of shake out the chaff of it and be like, okay, so these are the main elements.
Right. Like you were able to come to the table with a clear vision of where like, you are, what
this
you
is
need.
what my frustrations are.
Yeah.
This is how I feel about it. This is what I probably, like, I know is probably the actual reality case, but this is how it's making me feel.
Right.
And I don't like that. And also, it's not my fault.
Right.
So, there you go. That was a big chunk of it, was like, I didn't do this. I didn't ask for this.
Well, and
this
then
isn't
other
my
people
fault.
Implying, like people who aren't like directly associated with your goings on.
Yeah.
Yeah. I get that.
So, yeah, no, last week really, really helped.
Cool.
But
you
all
hear that,
that
guys?
to
You
say,
helped.
Yeah, of course you helped. They're very helpful. Sorry, my lip gloss is bugging the crap out of me.
She just wanted to kiss a tissue paper. Showing off.
Yeah.
Don't lick it off. That's gross.
No, I'm not licking it.
It looked like you did for a second. That's fine.
I just have to get
Anyway.
it inside, where it like gets built up.
The cycle of change.
Yes.
Let's get into that.
So we have like 4 main elements here, right? And that's the diagnosis. So there's limbo, which is seeking a diagnosis or not even knowing that there's like a problem, right? But you are in essence alone with the issue. Then comes diagnosis, hopefully.
Diagnosis
or a direction.
Yeah.
Like new clues. Because it really is. It's very much an investigative process.
Yeah, oh yeah.
To puzzle out.
It took us years to get to where we had an idea of where to go.
Right. Well, and we had many different suspects that we were like, oh, it's that one.
Right.
No, it's not that one. So the diagnosis, the mastery of that diagnosis.
Yeah.
The change in that diagnosis, or change as in like at the addition of something else, a comorbidity or the worsening of
a new thing.
Yeah, exactly. And then being able to reclaim that mastery again.
Yeah, getting your confidence back, understanding. Yeah. And then starting all over again.
Right.
Because this isn't a one-time thing.
No.
That's I think the harder to deal with the second time around. Because the first time you're like, oh, I did it. I figured out what it is. I know what to do. I know what I'm capable of. And then you'll hit a roadblock and be like, I'm back to the beginning.
Yes.
And I don't know what to do.
Right. Well, and then you feel there's so many feelings of failure.
Oh, yeah.
That go along with it because, and I talked to both of my doctors about this before too, I didn't realize how much I put into like being good at this.
Yeah.
Right? Like there is a sense of pride in being good at this because I work hard to be good at this.
Yeah.
And I've done a lot of like social emotional work to be good at being in pain and to like be able to live my life that way without feeling like my life is being stolen by my pain.
Exactly. It's like reclaiming it.
Yeah.
In a way. It's like you have a strong enough handle on everything that you can confidently do things.
Right. And this like, I can do this. Like,
right.
I've got this. It's fine. I've got this. Sometimes it sucks more than other times, but it's fine. And it's always been that way with the like, it's pain and it's also fine.
Right. I mean,
right?
it's the same thing for me. Like,
yeah.
The first time we had to do the second time around really was the side pain. Yeah. When it came back.
Yeah.
And I was like, oh no. Yeah. Because that was my spinal surgery got rid of a tumor and that was supposed to fix it. And then like 3 months later, I sat down on the bed and then I got stabbed in the side and I was like, no, I'm not doing this again.
Yes.
Nah.
That is the exact thought that was going through my head when the symptoms started again. At the level and intensity and extremity that they were last year, was this like, I can't do this again. I remember what that was like and I can't do that again. I don't know how I did it the first time. I can't do this again. And it was like, there's a certain despair in knowing that you actually can do it.
Yeah. Again. Because it means you're going to do it.
Yes. And there's this like, I know I can and I know I'm gonna, but I don't want to.
Right, exactly.
I don't want to. I don't want to do this again. And then that, I don't even know. Because it's not like, I mean, it is anxiety in a way, but there's just this like.
I get what you're saying.
You know that robot display?
Yeah.
Where it's sweeping up the oil?
Yeah,
as
constantly.
It's leaking oil?
Yeah.
Yes, that's how it feels. Like I'm hemorrhaging while I'm trying to put it all back in, but I'm losing it as I'm moving away. Like, the futility. Okay,
right,
that's
futility.
I think where I was going. That like, yeah, there's a sense of futility that goes along with it, where it's like, what does any of the work that I have done mean? If this is going to floor me,
all this work.
If this
what
is
does it get me?
Nothing.
Why did I do it?
Pretty much. Yeah. So very, very much that feeling and that sense of just like, and I mean, I had a small one when my shoulder dislocated the first time after surgery.
Yep.
And I left the room, went downstairs and cried. And it wasn't just the pain. And it is painful after you've had it fixed because it's tight.
Yeah.
And when it comes out, it is. But there's also that like, oh my God, this is going to be the rest of my life.
Yeah.
I can fix it, but then it's going to break again.
Yep.
Which is interesting because I haven't had that with my hips. It's very much
No, I feel like hips are the same as shoulders, though.
We just expect it.
Exactly.
Yeah.
Like we know
this will last however many years.
Because it's the same situation, same feeling, really.
Yeah.
Like we know this was gonna happen again.
So it's like that eye roll.
Yeah.
Is the like, exasperated. Okay, here we go. But the face, because it floored me so badly last time, and because I was so non-functional, that fear was just overwhelming.
Do you think that to some degree it was exaggerated in your head? Maybe not the pain, but the functionality loss?
Maybe.
Because
I can't remember a lot of what was going on.
You remember
at the
it
time.
being bad.
Yes.
I'm just
remember
wondering,
crying at work a lot.
because once it came back, you were calm again.
Yes.
The waters had chilled.
The fear had dissipated.
Right.
Because I was like, oh, we're here. Okay.
So I'm just wondering if maybe there was like, not a lot, but maybe some anxiety or some like additional.
There was the anxiety of the anticipation.
Right.
Waiting because of the pattern of last year, like the way that it progressed last year was so extreme, where it was like toothache. Maybe not a toothache, sort of a toothache, kind of a toothache.
Well, we both
my God, it's getting worse.
We
oh
both
my
had,
God,
like,
it's
tooth pain
other
at the same
places.
time and...
Oh my God, it's like out of control and I want to die. I want to die. This is the most extreme pain I've ever dealt with in my life. And I don't know what the heck to do because there's nothing that makes it better. So it was really the build that I was like anticipating. And it's not quite following that pattern. So I'm like, okay, I'm going to wait and watch and gather data.
I think too, like the stress of it all. Once you were there, the stress dropped because it's there.
Yes.
And then
like I was no longer moving toward it. It was there.
There, right.
And we were there. And I was like, all right.
And like
shoes are dirty.
Now that you have open doors,
yes.
the stress will drop.
Yes.
So hopefully that, there's like a correlation that could be drawn that maybe.
Well, and I really thought, I was thinking about this earlier about, when someone says, oh, it's not that thing that you thought it was. And part of you drops because you're like, okay, so now we don't know what it is.
Right.
I really thought that there would be more fight in my brain about them being like, oh, it's not trigeminal neuralgia.
Right.
Because,
like defensive in a way.
Yeah. Because trigeminal neuralgia accurately depicted the amount of pain and the severity of the pain. And now I'm not quite sure if turning and pivoting to a new diagnosis, the pain level will be taken seriously. But I'm not fighting it, which is interesting. I really thought I would have been, where it would be like, well, no, that's got to be what that is. Or like, great, you're telling me that it's not that and it's all in my head again.
Well, okay, let's attach that to the cycle.
Yeah.
That was the beginning of the fall in a way.
Yeah.
Now, because it's like you're starting the cycle over.
Right.
New diagnosis, right?
Yes.
So this would be the fall in a way. And so you were thinking you'd be more defensive of it because it like takes away.
Yes. The context, right? The context for other people, because it's not for
me. It's like the difference between like when someone's like, oh, you were sick, did you have the flu? And you're like, no, I had a cold, like a bad head cold.
Right. And they're like, oh, it's just a cold. Yes.
Yeah.
So that would be like, I don't know. There's just, it's interesting because I really thought I would have been like retrospectively.
Yeah.
I really thought that there would have been more of a, oh, well, are you sure it's not this just because the meds aren't working?
Yeah.
But the fact that the small fiber neuropathy fits better.
Yes.
And there's more context for it within what I already have going on.
Exactly.
Makes more sense.
Yeah.
And comes with more options. And that, like, the door opening was the beginning of the climb back to some kind of sanity. Right. Because what did I read the ones that I put under? Yeah.
So diagnosis is the joy.
Right.
Because especially for us.
Yeah.
And people who are
probably.
hunting and actively trying to figure out what's wrong with them. When you have a diagnosis, it becomes a celebration.
Yes.
It's
and relief.
Yeah.
Tons of relief. Yeah.
Because, oh my God, I know what it is. I'm not crazy.
Right.
We know how to treat it now.
Yes.
There's so much that goes with it.
And it's real and it has a name and all of those pieces where you're like, I can tell people what's freaking wrong with me.
Yep. So then you go from diagnosis to mastery.
Yep.
That's the researching it. That's the learning your new limits. That's and then you had under that the pride. And you do. You take pride in how you're functioning through your
Right.
like new lens.
Yes.
Right. I love that one. Change the fall, which is, something's happening.
Right.
I have a new thing, or my thing got worse.
Right.
And it's not what anyone expected. So now I have to recontextualize things, and you have to not panic.
Yeah.
And you have to be able to accept it. Yeah. It's a
and
lot all at once.
Breathe through it.
Right.
That's
you have to.
Huge. Oh my god.
That's the hardest, I think, is you have to let yourself grieve, but also feel confident in it. You know what I mean?
Exactly. Like leave room for the grief that is there,
mm-hmm.
but also understand that like you still got this.
Yeah.
And I get that, like, sometimes that's so frustrating. I don't want to hear that sometimes.
A lot of times. I'm right there.
I don't want to got this.
Right.
I want to lay down in the street and like take a nap.
Think of it this way. You're like, I got this for you, right? And you're like, I don't want this.
I don't.
And then you turn around, I got this. And just a pile of shit. And you're like, I don't want this. Have this.
Yeah.
Yeah.
Yes.
And then the climb is what we've labeled the last bit, because it's reclaiming mastery, which is, again, relearning things, finding your new limits, and getting out of the grief. Because you have to, you need to experience the grief, but you can't let it bog you down. You can't get lost in it.
Right. Right. And that's the thing is, like, I think the fall is going to look different for everybody.
Yeah.
Depending on what you're dealing with. And sometimes that fall is the loss of the confidence. Right. And my doctor was able to put that into words in an interesting way, where she started off with like, I'm going to be really careful about how I say this because I don't want you to hate me.
Right.
And I was like, oh my God, here we go. And she was like, before, when we first started working together, like you had a really firm handle on everything you were going through. Even if all of your pain wasn't necessarily controlled, you had, like, you were confident that you could do this and that you could live life with this. Yeah. And I was like, yeah. No.
At that limit, at that point,
exactly,
that was doable.
With all of those things, I was able to do that. That's okay. This is different and new. And she was like, yes, but I feel like it has shattered your confidence. Yeah. And I was like, no, that makes sense.
Right? Like,
that makes perfect sense.
It's like she articulated it and you're like, I get it. Yeah. So for me, because I know we were like supposed to relate it to stories and stuff.
No.
Lately, on the change, I guess, or on the reclaiming mastery. Yeah. I'm still on the fall. I'm falling and I know it. And it's to the point where I've lost confidence in my knees. So getting up is scary. Them. Walking is scary. Sitting in certain ways is scary. Like I've lost the confidence in them to function. Yeah. And it's not like I'm being dramatic. It's just
it's that you literally cannot trust that body part to do what it's supposed to do.
Exactly.
And that is a safety concern. So in order to be self-preservative, you have to be cautious.
Right. And I have been mourning the loss. Just I say that, but it's not like it isn't a big deal, if that makes sense. Like, to me, the grief of this is more like a sigh. Right. Like, okay, they're hard to work with. Yeah. Finding a surgeon is hard that'll do knee stuff, or finding someone that'll take you seriously. But I'm accepting it, you know, like letting it in, feeling that way, but then at the same time maintaining sanity. Right. You know, like it's not a huge deal.
It's impactful.
It is. Yeah. Exactly.
And that's, I think, where the grief is, right? Is the like, I want to be able to trust my friggin' legs to not drop me down the stairs, right?
Well,
like,
yeah. And then another something I just realized. Fuck me.
Oh no.
I've always had like a really good relationship with my knees and my legs and stuff. Even when they were like broken or damaged, like when I messed up my foot, I still would run around. Right. Or when I had surgery, I was fine. Like, I've always been able to like have faith in my legs. Yes. So it hurts a lot in a way for that to be the problem I'm with right now. Right. Because that, like, I used to do track. Yeah. I used to do with sailing all the time. And, like, my legs were a big deal. Right.
Well, and I'm smiling because what you said leads me back to something else that I talked to my therapist about, which was that,
how much you hate me.
No.
At least that's smiling.
No. Shut up. Is that like, oh, now I've lost it.
You were
I'll
sharing
find
with
it.
your therapist.
Yeah.
I was talking about the loss of my legs as being a big deal.
Yeah.
I did track, and then I was talking about sailing, and you said, "Oh man, my one-liner ruined it."
I'll find it. We'll make our way back to it.
Yeah.
It's fine. But essentially, that there is grief in that, right? Oh, it was brute force.
Mm-hmm.
It was the idea of like part of the pride that I felt was being able to push through everything.
Yes.
And then that pride eventually warped into this like that futility of like, oh my God, I don't have a breaking point. Where's my breaking point?
Right.
Why can I still do this? Like, if you're new here, there's a running joke called, and then she went to work, which is the idea that like, oh, Karina fell down the stairs this morning and then she went to work. Karina has dislocated her ankles so badly that she's hopping on one foot and then she went to work.
Karina got shot 3 times
and then she went
to work.
Right. And the despair of being like, oh my God, I don't have a breaking point. And I've set a precedent for myself on brute forcing my whole life.
My favorite thing about that, and this is not like, not literally favorite.
Well, no, I know
you know what I mean?
Yeah.
Is that it's all self-imposed.
Yes.
You know?
Yeah.
Like it's us being mean to ourselves in a way.
Therapist was like, who are you letting down? And I was like, me. I'm letting me down.
1000%.
Because being able to brute force it is my life. That's how I've lived my life.
And that's what's pissing me off with my legs right now is that
even
if I'm setting them correctly and I get up rightly,
you can't brute force it.
Right.
Yeah.
Brute forcing it causes it to get worse.
And when something stands in your way like that, like even through, I don't know, like we've had so many surgeries between the two of us. I think it's like 13.
Yeah.
I don't know.
We're up there.
But even through all these like surgeries we pushed through, and there's a weird pride of being able, especially when you take pain medication and people are constantly telling you that the pain medication is going to ruin your pain tolerance and your pain threshold.
Yeah.
And then being able to be like, well, here's all the stuff that I push through because fuck your pain medication and your pain threshold. I am fine. Thank you.
Yeah.
The pain medication's not ruining me.
No,
blah, blah, blah. Like,
yeah.
But you know what I mean.
Yeah, exactly.
That like, I push through. I do well. I am good at pain. I can tolerate so much pain. I can push pain away. I can snooze button pain.
I can sleep pain.
Yeah. Yeah.
It sucks, but you can sleep pain.
Right. But then to have that ripped away in a second, like having that rug ripped out from under you, and then suddenly you've fallen on your face and you don't know what to do because you're like, this hurts so bad. I don't want to have to brute force it. But I don't know how to live my life not brute forcing it. And is this going to be my life now?
Yep.
And that is the fall. Right?
So that is the fall.
That is the fall.
Right.
Yeah.
That's not just the injury, it's the realization of things have changed.
Yes.
Because it's different. Like this time, it wasn't my arm popping out. My arm is now dangling and it won't do the thing anymore.
I hated that. That was a gross face. Where you were constantly like, eh. Yes. But we were always good at pushing through pain. And then to have a pain that you can't is like, oh my God, I've lost my edge.
Right.
Oh my God.
I'm going soft.
I'm not as good as I thought I was.
Yeah.
My belts mean nothing. It's all scripted. But that's the fall.
That's the fall. Yeah.
And then the climb becomes putting your head back on.
Yeah.
Correctly and going, okay, breathe.
So I feel like,
it's okay.
The last part of the fall and the very beginning of the climb has to be the acceptance of the change, right? So once you've accepted it, you can start building a tool or learning tools or...
Once you stop thrashing against reality and accept that, like, what is, right? Like, it is, whether you like it or not. You didn't choose it. You didn't put it in place. You didn't let it happen. It's happening.
Right.
And now we've got to do something about it.
This is going to piss her off. Don't judge the change.
Yes. No,
I think that's more applicable
yeah.
than don't judge the pain, because we don't. But like the change, that's when we're judgmental. I think
yes,
that's where we apply these filters of like, ooh,
right.
now I'm the problem.
Bad.
Look what I can't do. Look at me not being
I'm
human.
a failure.
Yeah.
Yes. Because that's whew, and that it's hard. It's hard to like have the dichotomy, right?
Mm-hmm.
Especially when you're someone who is self-aware and who has done the work.
Yeah.
And then that moment when you're on your knees and you're like, oh my God, what was all the like work? Like, have I been snowing myself this whole time?
Right.
Is any of it real? Because I thought I was good at this.
Mm-hmm.
Have I been faking it the whole time? Like,
right.
what's going on here? Why is this different?
Mm-hmm.
But accepting that it is different.
Yeah.
Is that first piece.
And this is a great time to think about Lulu's advice.
Yes.
Extraordinary circumstance.
Yes.
It's not normal. It's allowed to suck.
It's allowed to suck. It is
Just
okay for it to be hard, because what you are going through is freaking hard. It's allowed to suck, and you are allowed to struggle, and you are allowed to cry it out, and you are allowed to be frustrated and angry and grieved. Like, it's okay.
Right.
It is okay. What you are feeling is okay. But remembering that, like, that rock bottom state can't be forever.
Right. Well, it's rock bottom, so there's nowhere else to go but up. So
yes. Yeah.
Start from there.
And that climb is hard, man. It can be really difficult.
Yeah.
But if we are able to turn around and remember our tools and the things that have helped us get through other extraordinary circumstances, and then build new tools and use our resources and not self-isolate.
That's everyone. All of you do it.
We all do it.
Even perfectly well people do it.
Yeah. Don't self-isolate. It's okay. You don't need to be alone in
you're
what
not
you're going
saving
through.
people from yourself.
Right.
You're just isolating yourself and making it worse.
Yes. And then you are in the miasma of hell alone.
And if
it's not good.
And if you're in a position where you don't have anyone nearby to kind of help you through things, like what we did with each other.
Yeah.
Join our Discord and complain.
Yeah.
Come on and complain with us.
Well, and that's the other thing is like, people hold a wealth of knowledge and resources and experience. And I'm so thankful that like in our Discord, even we have that huge wealth of knowledge and people who have been through things that we are just now setting foot into, and the way that they've handled it and the way that they learned not to handle it. And like, people are resources. Use them as such.
Also use them as friends.
Yeah, that too. Because we love you. But yeah, like, don't be afraid to ask for help.
Right.
And don't be like, I don't know, being chronically ill, we have a hard time being vulnerable in front of people because there's so much stigma to being chronically ill in general. And then on top of that is that, like, we're good at this part. And the like, oh, well, we got to just keep fighting through. We don't have a moment to sit down and feel sorry for ourselves. Blah, blah, blah. Like, but all of those things are natural.
Right. As far as the yeah, I'll get there. Yeah, I was just thinking about that when I was looking at it. Yeah. As far as reaching out for people, if you don't have people that understand, reach out for the Discord. That's what I was trying to get at.
Yeah.
Because we literally talk about stupid EDS stuff.
Oh yeah.
And it's like everyone just gets it.
Yes.
And if they don't get it, they can understand it without having to be told. Right. There's no judgments. There's just, hey, people that get it.
Yeah. People who have the same kind of context that you do and the context that people need in order to understand you.
It's just so nice to be able to go into the lives and go, God, I have backwards leg today. And nobody goes, like, what? Oh, they're like, God, I hate backwards leg.
I have chest shockies. Ooh. Maybe drink some more water and get some more salt.
Exactly.
In you.
It's like, maybe try this.
Yeah. But also like, ugh, I hate that. God. Yes.
And our Discord's so polite.
They're like, so wonderful.
They're like, instead of just telling you to hydrate, they'd be like, maybe try hydrating. It worked for me. It might not work for you, but it worked for me. They're not telling you there's only one way to take care of things. I love it.
Which is huge. I love that. It's the respect of everybody's different experiences, which is crazy. And I love that.
So getting to this point.
Yes.
Sometimes you won't have a big colossal event of change. Mm-hmm. You might have like a slow growth over time type thing. And then you'll have to notice that there is a change and that things have changed.
Mm-hmm. Like fatigue.
Fatigue.
That's a big one for me. And that was happening before the face.
Yeah.
Was the I'm struggling to be at work all week because A, fatigue and B, pain are kicking my ass.
I thought it was T-Pain.
T-Pain? Yes, it was T-Pain. He was kicking my ass.
Wow.
Beating me with a stick. I don't know. But yeah, there's that moment when it like hits you like a freight train that you're like, this didn't used to be so hard.
Right.
I didn't used to struggle this hard with this thing. Like there is very clearly a difference, and somehow I missed the transition.
Right.
But now we're here, and like with the hands and the tremor and the for you, your foot was a big one. I think. Yeah, where it was like all of a sudden, oh, where it's gone. What was
Phantom
that?
foot.
Yeah.
My neuropathy in my feet. I don't feel my foot. Yeah. I don't. But unless I hurt it, and then it hurts 10 times more than it ever did before.
Well, and I only notice it because of your context.
Right.
Because otherwise, it would have taken me until I was like, oh,
exactly.
I can't tell how hard I'm pushing on any surface, and driving is challenging.
Yeah.
Because I can't feel my feet.
Right.
Oops. And it's like a weird loss of proprioception, too. Like, I don't know where that thing is in space and time. But yes, so perceiving the change can be really hard. It can be like all at once.
I think that's one of those things that you kind of should have a built-in checklist for. Like put it on the checklist of things to just check in with yourself every month or so. It doesn't have to be all the time.
Just a functionality check.
Right, just a systems check.
Yeah.
So what systems are go, what's not.
Right.
Like what Ruth would do. Write down everything that's been going on and chart it.
Right. Which I'm bad at, because I'm like, if it's not happening today, I forgot that it existed.
Yeah. But yeah, step one is perceiving that there is a thing. So
yes. And then the data gathering phase.
Yeah.
Which is that information. What is causing that change? What has changed? In what, what's the quality of the change? How drastically is it impacting your functionality?
Right. Well, and there's the literal data gathering about the condition. Right. For me and you, knowing everything about it helps us understand ourselves. Yeah. So we like to dive in and be like, this is all the things that are connected to this, and these are the things that could be connected to it.
Yes.
And then you learn all about all that.
Yeah.
And then you add it to your repertoire of
Well, and it's that same thing, my therapist gave me these exercises that are somatic processing, and you got to feel the feel. And I'm like, no, we do that. We do that. But the actual data gathering of hunting down answers and having it helps us stay calm in events that are triggering, right? A chest pain, for instance. We can contextualize it through many different filters and go, oh, it's probably this thing.
Yeah.
And then we can calm down the system and go, because I know for a fact that nothing is too terribly wrong, and I'm not dying.
Right.
I might feel like I'm dying and the brain freaked out for a half a second, but I know it's actually this thing and I'm okay.
Yeah. Like when I get stuck on the floor, if I'm kneeling, my patella will slide off, and then my ligaments get caught and I get stuck. I have to have someone come and pull it back into position. But before that, I knew what that was. It would freak me out every time.
Right.
But now that I know what's happening, I don't care. I'm just all right, come pull my leg. I'll wait. That morning, I got stuck in the closet. I told you about that, right?
Yes, you did.
I don't know if I talked about it on the podcast, but
he got stuck in a closet.
I got stuck in the closet
for a long time.
There were clothes everywhere, and I was helping Jen carry out this big box so that we could put it on the bed to go through it. The box fell apart, and I went to grab things, and I landed on my knees, and then and I got stuck. And Jen's like, and I was like, don't do anything now because it hurts so bad that I can't do it.
Don't touch it.
go to work. So she went to work, and I was in the closet for an hour until Rin comes in. Why are you in the closet? I'm stuck. What? Why didn't Mom help you? She had work.
Yep. That happened to me at work one time, where I was, it was bad because I was in the knee brace, the hard custom knee brace.
Yeah, held it.
And it dislocated, and I just was like, I need to leave the room. And I left the room in the middle of like a training, and I went to a dark classroom, and I sat on the floor, and I cried, and I had to like take the thing off.
Yeah.
And it hurt so bad. And it just, yeah. Oh, not good. Not good. Ugh. Knees bad. Don't like. But yeah, so that data gathering should hopefully eventually lead you to questions to be asked, theories to be made, and actionable steps and plans.
Yeah, that's the big one.
Yeah.
Because the actionable steps will help you with your stress levels. Once you have a plan and you know what's going on,
right,
the limbo isn't as scary.
That's why, like, part of that somatic thing that she has me do bothers me a lot, where it's like, you don't have to change anything. And I'm like, but I know if I just do this, it'll be fine. I don't want to sit there and process it when I know I could be like, pop, fixed, then the pain goes away. That bothers me.
Yeah,
but
I got you.
Yeah, no, make an actionable plan. And that can be hard, and that might take some tuning.
What's the last stuff on here?
Because we got some tuning to do for my actionable plan.
Oh, okay,
but at least I have a direction. And that right now is enough for me, which is good.
I think the only thing left that we need to talk about really is like absorbing the change.
Yeah.
So accepting
yes.
becoming one with it.
That's the mastery right there. Yeah.
Yeah. And getting to know your new boundaries.
Yes.
And then we can call it.
Yeah. So, yeah, the mastery of it is like absorbing the change, not resenting the change.
But that's going to be judgment on yourself, which is a bad place to be mentally.
Right. Well, and it leads us to that, like, we don't need to moralize everything.
Right. No.
It's not a bad thing.
It is a thing that happened.
It's not a good thing. It's a thing. It is a state of being that is right now. And that is enough. And we don't need to apply anything to it. Because if you moralize things you can't control,
yeah,
where does that moralization go in the end? To you as a person and your ability and blah, 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 blah.
Yep.
And that you are bad, but you are okay. You are okay. It's okay. But yeah, we call it like absorbing, like it's that baseline, right?
Yeah.
Being able to baseline everything. And maybe not.
Right.
But like the face is not baselined.
No.
Currently.
I don't think that can be baseline.
No, I don't think so either. Because it's like either it's there or it's not there. And if it's there, you know. Oh, you know.
Yeah.
But being able to carry on, I don't know. It's like putting it in the backpack.
Yeah.
It's in your inventory now. And you put your backpack on and you walk through life.
No, it's your little kid analogy.
Yeah.
You're walking with this thing that's not great.
Right.
Not the kids aren't great.
No, it's
kids aren't great. She's right.
The analogy is like toting around a screaming toddler.
Yes.
And then you have to try to appease this poor kid who's screaming for God only knows what reason. Or like,
and everyone's looking at you and judging.
He's like, the sky is blue, and having a temper tantrum, and you're like, yeah, the sky's blue.
Yeah, guy. It's
okay.
Gonna be.
It's like that.
Yeah.
But yeah, no, it's very much like that. Like walking around handcuffed to a tiny screaming child.
Yes. 100%.
And that's kind of how that works. Yeah. Where else? Recognizing the moment. Oh, yes. So recognizing the moment as a moment.
Yes. We talk about that a lot.
Yes.
But for anyone who's new,
let the moment be the moment.
And feel your feelings.
Yes.
If you're overwhelmed with your newfound whatever.
Right. Your level up.
Let yourself
you didn't want.
Have the meltdown.
Yeah.
Get that out.
Right.
Don't hide it. Don't. You're allowed to have this.
You are allowed to have those feelings.
Yeah.
It is an extreme circumstance. It's an unusual circumstance. And it's not fair. And I try to avoid it's not fair.
Because that starts moralizing.
Well, yeah. And it makes me feel like stupid because I'm like, nothing is fair.
Right.
Fair is a made up concept. Whatever.
Where do I get off?
Right. Like, why do I think that it should be fair? That's stupid. But like having the feeling of it's not fair is a very typical one in those circumstances.
Yeah.
And it's okay. And it doesn't mean that you are a failure. It's all right.
And you're not bad for thinking those thoughts. That's the one thing is like, I know people who are really sensitive to the way they think.
Yes.
Because they think it defines them.
Right.
Because they'll have a weird bad thought.
Yeah.
It's like, no.
It's just your brain, buddy.
Yeah.
It's just your brain.
It's not.
Responding to stimuli.
Yeah. Literally. So you're not bad because you wanted to push the toddler down the stairs. You're bad for pushing the toddler down the stairs. See the difference? One's a felony. So.
Yeah. Don't push toddlers down the stairs.
Only old people.
Only me. What? Anyway.
Sorry.
No, you're fine.
Sorry, not sorry.
Yeah, and then getting to know the new boundaries, which is challenging because there's going to be grief along the way.
If you guys are anything like us, which I know a lot of you are, finding new boundaries is more like, I don't know, making a lot of mistakes in rapid succession.
Yes.
Does that make sense? Because it's not like we're like, I'm going to try the pool for the water. Like, is it warm? Is it cold? We're like, what is that? Water? Okay. Oh, that was acid. Whoops.
Oopsies. Maybe I should look before I leap.
Maybe I should have touched it. I didn't think about this. I'm dying.
I'm dying. Yeah. No. Yeah. Yeah. Because it is. It's like you knew the world, right? Like your map was totally lit up, and now you have all these dark spaces that you have to go fill in, and some of them are filled with goblins, and some of them have
#Go Team Gabo.
And some of them are just pits of acid, right? Like, but you gotta slowly kind of explore and figure out what's over there. And are you allowed to touch that, or is the screaming toddler gonna like lose its shit?
Yeah. Well, this is an interesting thing just to talk about for real quick.
I'm gonna write something down.
With your trigeminal neuralgia, we're trying to figure out a baseline or the new limits is impossible.
Yeah.
Since it's a roulette.
Yes. Yeah.
Even if it is, small fiber neuropathy, it's still a random thing, right? You can't learn that the cold affects it because it only affects it sometimes.
Right.
Sometimes the wind bothers it. Other times it doesn't.
Yep.
It's a crapshoot.
Yes.
So there will be times that you can't.
God.
Can't really. I mean, you can get ready and brace for the fact that it's chaos.
There is something I'm thankful for in that vein, though, which it might sound weird to some people, but I am thankful that there isn't like clearly defined triggers.
Yeah.
Because it helps me to not like baby it. You know what I mean?
Right.
Like I'm not guarding. I'm not guarding because there's nothing I can guard against.
Yeah.
What am I doing? Especially because when it's gone, it's gone.
Right.
There's nothing there to guard from. And then suddenly it's like, hello. And I'm like, oh my God, my face is on fire. I don't know what's going on.
It's frozen and on fire and drippy.
And
why is my face
hurts.
drippy?
God, why are you soaking wet?
I jumped into the acid pool again.
I'm crying.
I shouldn't have done
It
it.
was
I
bad.
thought maybe it turned to water. Oh, come on, big guy. You should have known better. It looks so
Jesus
clear.
isn't here, okay? It would have been wine. What? But yeah, no, I am grateful.
Because it's an acid.
Yes, thank you. But I am grateful that I can't predict it. Because when it's not there, I'm living my life because I have completely forgotten about it. And then it surprises me every time. And that part I'm not so grateful for. But, yes, this. So, like, having respect for your body and its new needs.
Oh, yeah.
Because we talk about, like, redefining that baseline and finding those new boundaries. And part of that boundary building is respect, I think.
Yeah. Honestly, respect is the great way to put it, since we like to delineate ourselves from the body. So if you're like us and you're like, oh, I'm not the body, I'm the thing in the body, and I exist alongside it.
Right.
Respect it.
Yes.
Makes total sense to me.
Yeah. And have some kindness for it. I know it's like, it's not super kind to you. I get it. Oh boy, do I get it.
Mm-hmm.
But also it doesn't mean to.
Right.
It doesn't know. It's not its fault that it's missing a bunch of like weird protein making stuff. She didn't do it on purpose.
Yeah.
But I have to be respectful of those new boundaries, or I'm going to have a screaming, crying toddler.
Mm-hmm.
And that'll just be in perpetuity. So, yes.
Hopefully that was
I
at least
that's
relatable.
Right.
I think we did a good job.
I think we did a good job. We kind of went off on this one. So
This is a good one, though.
hopefully you guys enjoyed it.
Yeah,
Take your meds.
Oh, it's time for this.
I think, yeah.
Yeah.
Okay.
No,
I was
no,
like,
I was because
No.
last week I redid yours on accident because we had a visitor and I was distracted. And I didn't hear you say the thing. Stupid.
Take your meds.
Take your meds.
Drink water.
Drink water.
Hydrate or dihydrate.
Abuse your family.
Out of love.
Out of love.
Oh, I punched the mic.
Haha, karma.
What else should they do?
Go outside if you can. If it's nice out,
Yeah.
enjoy the weather. Take in the air.
Yes. Get some sunlight.
Sunlight.
It is good for you. You need it.
Yep.
It will make you feel better. Go on a stupid mental health walk for your stupid mental health. Sorry.
Yeah,
I'm done. Also have a snack because you are a snack and you deserve it.
it's true.
Yeah. With all that said.
Hey,
Oh.
she skipped the bipolar bears. Now you say it.
If you're bipolar, it is time for you to check in with yourself. How are you doing? How are you feeling? What are you feeling?
And how extreme is it?
Yes. And if you are sitting there feeling like the whole world hates you and you should buy a condo in Guatemala
Hit me up.
and run
I'll
away,
run away with you to Guatemala.
do that. Just
Let's do it.
eat some food and take a nap.
And then meet me in the airport and we'll go to Guatemala.
Check to see if your medications
I
are
am not medicated.
okay. You need to be medicated. No, you need to be medicated. And that guy behind the camera needs to be
I'm out of
medicated.
Abilify.
That's God.
Sorry. I just remembered.
This man.
I'm bipolar.
You need your medications.
I know.
Are you feeling them?
Yeah.
Yeah?
Yeah.
Why are they taking so long?
I don't know. Jen was supposed to pick them up yesterday, but maybe they just weren't ready.
Okay.
Because she picked up her meds. And the point is, I'm going to have my Abilify. I'm just
Soon.
out of it
Good.
right now.
Okay, fine. Great. Good. Wonderful. I think my husband might also need to fill his medication this week. Because last week he said he was almost out. He's
Ugh.
sitting there like, yep.
Bipolar bros.
Bipolar bros and bears. Check in with yourself.
Mm-hmm.
Don't spend that money. Give yourself a budget, maybe.
I'd say don't spend the money right away. Give it like a day. That's
not long enough.
oh, for me it is.
No, because that's time for you to build a really weird case that only makes sense to you. And you
don't
have all
do
this
that.
weird backwards reasoning.
Don't shenanigans
Look
your
at
way
this
into
man.
trouble.
Look at him. Because he knows. He's like, but I did the research.
He
and
did.
it'll only be this price once every 47 years
Yeah,
that
that's
I've
called a
just
deal?
stumbled onto. And
That's
it definitely
thrifty.
won't go on sale again in another month or
It
two.
won't. They'd be
Also,
dumb to
I
take that
need
deal.
7 of them because
I have
children in
friends.
Africa might need some. And
course.
if I ever meet children from Africa, I would want to share with them.
They need the
See?
rock.
Like, obviously we need to do this. And you're like,
That's not what I meant.
no, you don't need to buy 17
That's not what I meant. And that's not what she meant.
fancy fish. I don't know.
You put off the buying of the thing, and if you can wait, then you can continue to wait. It's that simple.
If you can wait. Okay, that's fair.
Yeah, cut me off with your little tirade there. Jesus.
Also, if it's in an advertisement, no.
Are we talking about like illegal things?
No, I'm just saying, like, if they're trying to sell you stuff.
No. Okay. I
Yeah.
gotcha. I understand.
Because it's not that cool. They're trying to sell you stuff.
Anyway,
There you go.
just check in with yourself.
Anyway.
And if you can put it off for a day, you can put it off longer.
Yeah.
Until you're not manic. And then maybe you still get yourself something nice for making it through the mania.
And if you're in a low, bro, do something nice for you.
Reach out.
Take a bubble bath
Yeah. Do the self-care.
with candles.
Eat, drink, sleep.
Yes.
Get comfy.
Yes.
Then reach out
Sunlight.
if you need to reach out.
Yeah.
You can reach out to us. We've had people do that actually a couple times.
Yeah. So, and we are always happy to answer the call. So, yeah, we'll be there. All right, my friends. Hopefully you got something out of this episode. It was a little long, but I think it was good conversation.
Yeah,
at least.
Great.
So, awesome. It is that time then, huh? All right. Thank you again. We love you. Take care. Hi, Yeti. Thank you, Ruth. Thank you, all of the rest of everybody. Thank you to those in the not the Discord, the Patreon. Patreon. Yeah.
Join the Patreon if you can. It helps support us and grow.
Yeah.
We have things that we want to try out over the summer, and if you join the Patreon, it make it easier for us to do those things. So.
And you get full episodes.
Yes, we do full uncut episodes. It's like an extra hour of us having. Actually, we sometimes have really good conversations about things, but
sometimes
it's usually us
hilarity
being weird.
Yeah.
It's worth it.
It's funny. I think it's funny.
All
right. On that note, it is time to say goodbye.
C sharp.
So, no.
B flat? It's the same note.
My husband. All right, fine. There we go. Be kind to you. Be kind to others. And we will see you in the next one.
Bye.
Bye.
And on that note,
it just fell on me.
wham!